Hi, this is Dr. Bob Dannenhoffer. It's August the 24th, and this is another of our Facebook Live events. I'm the Public Health Officer for Douglas County and been at this since the beginning, so it really is a dark time for us here. But this is time for us to answer your questions. So if you put the questions to us at Facebook questions at douglaspublichealthnetwork.org, we get to see them beforehand. And if you have other questions, put them in the comment section, and Vanessa, who's working at home, will go ahead and send them to me. We have a lot of questions today, so we may not be able to get through them all, but I'll try and do as best I can do. As always, we start at the world level and then move down to the local level to tell you what's going on. So in the world, the total number of cases is beginning to level out a bit again. It's been really increasing over the last few weeks and is beginning to level. And I think especially because the number of cases in South America is going down. You'll remember they hit the depths of winter and are now starting to get warmer weather. And so that may have something to do with it. It may just be that it's burned its way out in South America. However, we are seeing that it's still very active in the Middle East, especially in Iran, and Iran borders against Afghanistan, and there's so much chaos and disruption in Afghanistan that we really worry about that. Still very active in Africa. We're starting to see it pop up in different places in Africa, which is a bit concerning. And especially in Asia, we're seeing a lot of cases in Malaysia and Indonesia. Malaysia and Indonesia are worrisome areas because they produce almost all of the medical gloves that we use in the United States. And they're also seeing a lot of cases in the Caribbean. And this is the hurricane season, and the hurricane season causes lots of disruption in that area anyway. And now with increase in the COVID cases, that is a bit of a concern. And then we're also really worried about the UK and Israel. So the UK and Israel have been two good comparators to the US. Remember, we said that what happens in the UK happens here 6 weeks later. So about 10 weeks ago, I said we really need to worry about the increase in the UK because we might expect the same 6 weeks later, and this is what we're seeing. And what we've seen in the UK is that they had a big Delta spike that peaked and came down, and they thought, oh, that's great, but it's now going up again. And similarly in Israel, they had a Delta peak, which they were able to beat down, but it's now up again. Now, they're not at astronomical levels. They're at levels of about 40 cases per 100,000 per day. But still, that's a lot more than they had before, and it is a worrisome area. The other thing that we worry about in South America, although cases are decreasing, they are seeing an increase in the Lambda variant. Now, the Lambda variant is not taking over very much except in South America, but the Lambda variant is worrisome because the Lambda variant does seem to not be well controlled by the vaccine. So what we're concerned about is now a new mutant that takes the worst of both the Delta, which is very contagious, and the Lambda, which resists the vaccine, and it coming together and causing a new variant, which could be even worse. In the US, we have a continued uptake in cases. All of the states have increasing levels except for those cases that had an early Delta spike. So Louisiana, Missouri, Arkansas, Louisiana had early Delta spikes, and now they look like they've hit their peaks. But in all other states, we're seeing an increasing amount. It's really bad in Louisiana, Mississippi, Florida, Alabama, and Georgia. I mean, the numbers there are just astronomical. Think of what's happening in Douglas County over the entire state, and that's basically what you're seeing in Florida. And then we're starting to see scattered increases in Alaska, in Hawaii, in Wyoming, and unfortunately in parts of Oregon. And so Oregon, which had been fairly quiet until just a few weeks ago, is now very hot on both the Washington border, so those counties on the Washington border, and in Southwest Oregon. However, during all of this stuff we're seeing that although it's bad in the world, bad in the US, bad in Oregon, there are some places that have very little disease. So in Oregon, Benton County, very little disease. In the US, Pennsylvania has very little disease, and we think, Pennsylvania, because it's clearly had some Delta introductions, and yet they've not had a lot of disease there. And in the world, still very low case rates in New Zealand and South Korea. Douglas County cases continue to rise. We're now averaging over 150 cases per 100,000 per day. That is a really, really high number. To get you the impact of this, we've had more cases in August so far, and we're not even done, than in the entire first year of the pandemic. Think about that. So more cases in August of 2021 than in the entire first year of the pandemic. We're averaging more cases on a daily basis than Boston, Washington, or Detroit. Big cities. I've lived in both Boston and Washington, really, really big cities. And we're averaging more cases than they are. That is just stunning. And why aren't they doing it? I mean, obviously Boston and DC have clearly had some introductions of the Delta variant, and yet they've been able to keep it down because they have three things that are different. One is a much higher rate of vaccination. The second is they've had worse disease in the past, and with worse disease in the past, or people have natural immunity. And the third thing is those places still have some COVID restrictions. And so with better COVID restrictions, more natural immunity and more immunizations, even though they've had Delta introductions, they're not seeing nearly the problem we're seeing now. Our hospital is really overloaded. We have 81 Douglas County residents in the hospital, mostly in Douglas County, but some scattered around the state where they need extra care, some in California, some in Washington where they need ECMO. I talked to a mom today. Her 17-year-old son is in the ICU at Dornbecker. He's really sick on a lot of oxygen. And so we really, really worry this is really now starting to spread to younger people and starting to make younger people really sick. So the 17-year-old is up at OHSU. We have a person in their 20s up in Seattle on ECMO. So it really is affecting younger people as it goes on. And the hospital is full. The National Guard is here. You heard last week about a patient at Mercy who died waiting for a bed. And really the hospital is keeping its head above water. But when I talked to them today, they said we're occasionally sinking under. And they're sinking under not because they don't have enough physical beds. I think they have probably enough physical beds, but you need really skilled staff to do this. You can't just bring somebody in to go ahead and work in your ICU. And so they have redeployed people to work there. Even with that, that is a problem. And they have a lot of people who are COVID positive. So they work in the hospital and either got COVID at the hospital or got COVID at home. And so a big place like Mercy with hundreds of employees do have people out. And again, when we look at the people in the hospital, almost all of these people are unvaccinated. The numbers change day to day, but again, it looks like the vaccine still gives 80 or 90% protection against hospitalization. So again, almost all of the people in the hospital are unvaccinated. And when we look at our 18 and above population, actually most of the people 18 and above are vaccinated. So 52% are vaccinated, and yet they only make up about 10% of the cases. The other 48 that are unvaccinated, they make up about 90% of the cases. The vaccine is not perfect, but it's still working very well. And we really need more people to get vaccinated. And the really sad is the deaths. We've had 29 deaths this month. In the whole first year we had 30 some odd. So to have 29 deaths this month already, and it looks like we're predicting 1 or 2 or 3 deaths a day for the next 3 weeks. That is really sad. 1 or 2 or 3 deaths a day for the next 3 weeks. And again, almost all of those are unvaccinated, ranging in age from 27 to 90. Now, among the hospitalizations and deaths, what we do know is that older people, they just don't make good reactions to vaccine. They just don't have a strong immune system. And so most of the breakthroughs we're seeing in the hospital and most of the breakthroughs we're seeing among the deaths are among really old people. So a 91-year-old who was vaccinated today was one of the deaths in the last week. But again, we had 2 deaths today of people in their 50s, both of whom were not vaccinated. 50s is so young, 50s is just the time when your life's hit a groove, just the time you're expecting to retire, just the time you're expecting to have grandkids. And again, some deaths there. So it really, really, really is worrisome. So we have a bunch of things that we'll talk about here if they're not in the questions. So we'll see. So over the counter testing kits being counted among the positives in our county. So if somebody has symptoms and has a positive over-the-counter test by NACS or otherwise, they're considered a presumptive case. We ask them to go and get a laboratory test, but they are being counted as presumptives. They are not being counted among the confirmed. So you may have noticed in this last week we've had a little uptick in the presumptives, and those again are people who've gotten the vaccine, who've done an over-the-counter test. So Guyla asks, is it true that a temporary morgue has been set up at Kmart and a hospital barracks as well, refrigerator trucks? So yes, the details are not exactly right, but yes, we have acquired additional refrigerated space for additional deaths. You remember, in our county, we have about 1,000 deaths a year, so we have about 3 deaths a day. In addition to the 3 deaths we have a day from other things, if we have 3 deaths a day from COVID, you have to have somewhere to put the bodies. So yes, indeed, there is some additional refrigerated storage space in Douglas County. So how long do you quarantine if you test positive? How long for the family and household contacts? This is really confusing. So if you test positive, you should isolate. So it's like quarantine, but you should isolate for 10 days after the clear onset of symptoms or after the positive test. Some people say, well, I always have headaches, and this started with a headache, so it's a little hard to know when it started. But if you had a clear onset of symptoms, it's 10 days from the clear onset of symptoms. If the onset of symptoms is a little less clear, then we do it 10 days from the test. For household and family contacts, so household and family contacts should quarantine generally 10 days, although I just did 2 videos, so one about contacts and one about how to know when you're really getting sick, and those will go up tomorrow, and those will answer all of those questions. So is the booster subject to an 8-month waiting period after the last jab for people in their 70s? Is a physician required to, is an order required? Where do we get it? What should we do? So this is complicated. So the CDC did approve a 3rd dose for people who are immunocompromised. For example, you've got cancer on chemotherapy, people who are taking medications which would dull their immune system, or people who had an organ transplant. Those people should get a 3rd dose as long as it's 28 days after their 2nd dose. The second thing we've heard about, and this has been more in the press than actually anything official, is that there's going to be a 3rd dose. CDC likes 3rd dose rather than boosters, so okay. So a 3rd dose, and they want people to get it 8 months after their 2nd dose. There's 2 reasons for this, is that the 8 months is the time when the vaccine is beginning to wane. We've known all along that the vaccine begins to wane about 1% per month. So at 8 months, it has waned 8%. And so that's when they picked. The other reason they picked 8 months is they said everybody get a booster, and everybody who showed up at once, it would be just chaos. If you do it 8 months after your 2nd dose, that's then going to get people in. So if they approve this, and it's not been written yet, but I would think in the next 3 weeks it would be, we would then start giving 3rd doses to people who got it in December and January. And that would then leave us, our big month for vaccinations was in December, and that would leave us then getting through the big hump of people got vaccinated in February, March, and April in October, November, and December. Now we have about 20 places in Douglas County to get the vaccine. So early on, we recognized that this would happen along the way, and recognized that mass events would be needed during the peak, but that what we would hope is that people would then go and get their 2nd dose or their 3rd dose where they get their regular health care at their clinic, at a pharmacy, or if we had a big event. So if you're fully vaccinated and have a breakthrough case, how soon after are you recovered would you be at risk of getting the disease again? So the story is that we think for 3 months after you've had a disease, whether you're vaccinated or not, you're pretty well protected. After 3 months, your protection goes down. So really for the 3 months, you're pretty well protected. But if you're vaccinated and have a breakthrough case, you probably have the best level of protection that anybody is going to have. How long after you have COVID should you wait before you get vaccinated? We used to say wait 3 months when there was not very much vaccine around, right? Because if you'd already had the disease, again, your chance of getting it in 3 months after the disease is pretty low. So we said, well, let's wait 3 months. Now that there's plenty of vaccine available, we say you can get vaccinated as soon as your symptoms improve and you're out of isolation, so 2 weeks or so after the illness. So we have a lot of questions about what urgent care should do and how they should do it and when they should be open, and whether they should test inside or outside. Public health is about public health. We're not telling people how to practice, what to prescribe, what not to prescribe, when to be open and when not. We do meet with the urgent cares once or twice a week to ask them what they're doing and work with them. I think all of the urgent cares in town are very much invested in this response. But you'll have to remember, they've been going out this for a long time, and especially now when they're seeing hundreds of people a day, they're also a bit stressed. So public health says no control over what providers do. So in a practice or the urgent cares, we've talked to them about being more available for stuff so that people don't wind up in the hospital, trying to separate their COVID and non-COVID stuff, but it is really hard to do. I will tell you, in our pediatric clinic, separating the well child from the COVID has been impossible. We have not been able to do it, and I would think the urgent cares would have a similarly difficult time to do it. So if we get COVID and have natural immunity, will getting the vaccine put our body into overdrive? Joe asks. We don't think so. So there are a lot of people who've had both COVID and then or have had the disease and then get the vaccine, or the other way around, and it doesn't seem to be putting bodies in overdrive. So how many people have died from the vaccine locally and nationally? So again, you'll remember for the last 2 weeks I've been telling people, really, all these people say they know all these people who have died or been hospitalized from the vaccine. Again, we've checked with the coroner, we've checked with the hospital, we've checked with the intensivists, and we really don't know of anybody that has died from the vaccine. So locally, the answer is we don't know of any, but geez, there seem to be a lot of people who know a lot of people, and please send us their names and we'll check it out. Nationally, we know there are some people who've died of the vaccine. The people who've died from the vaccine nationally, there's less than 20 that have died from clotting things associated with the J&J vaccine. And then there are some that have died from the myocarditis associated with the vaccine. But again, the number of these nationally is very small, probably a dozen or so from each of those. Considering there are 200 million vaccines, the risk of dying from that is low. 3 people died in Douglas County today from the disease. So I know 3 people died today in Douglas County from the disease. So while the vaccines are not perfect and there are some risks, the risks are infinitesimal in comparison with the risk of dying from COVID. So can a fully vaccinated person be a spreader, Donda asks. Well, if a fully vaccinated person gets the disease, and that happens sometimes, doesn't happen very often, but when it does happen, their disease is just like if you're not vaccinated. They get the disease, they get sick, they can spread it for a little bit. Although we do know that fully vaccinated people spread it for a shorter period of time than unvaccinated people, but they can still spread it, typically in the 2 days before they have symptoms and the 2 days after the symptoms. So yes, a fully vaccinated person can be a spreader, although statistically so much less likely than if you are not vaccinated. Yeah, so Tammy says, what's the efficacy of the J&J compared to the others for regular COVID and the variants? This is very interesting. For a while there, J&J was thought to be underperforming, but recently the J&J actually is performing pretty well. So I think all of them are reasonably effective at preventing disease. Probably 70 to 85% effective in preventing disease and 85+% effective in preventing hospitalizations. So my family took home test kits and all were positive. What do I do now? So we did a video last week and it's on the website. It's about a 10-minute video and it tells you what to do if you're positive. The most important thing is if you're positive, stay home. You've got to stay home because if you go out and go to doctor's offices and shop and whatever, you could spread it to others. So you need to stay home from 10 days from the onset of your symptoms or from when the test date was if you didn't have lots of symptoms. So you've got to stay home. In addition, you need to know what to look for if you're getting worse. And I just did that video, and it'll be up tomorrow, about what signs to look for that you're getting worse. And there are a couple of signs, right? So one of the signs is shortness of breath. So shortness of breath is a really bad sign with COVID. So if you can't walk up the stairs like you used to, if you can't hold your breath for 10 seconds, if you have to stop in the middle of a sentence to breathe, those are all warning signs, and you really need to get more help. We want people to avoid dehydration. So dehydration is one of the things that we'll see. When people have this, they don't feel great, they don't want to eat, they don't want to drink. Food and water will sometimes taste terrible, so they wind up getting dehydrated. That really hurts, so please be sure you push fluids. And so those would be the big things. So the third one we see is some people have mental status changes, so a change in the way they're thinking or processing information when they get COVID. That's a bad sign, and that could come either from breathing problems or from metabolic problems. So if you're there and you're not thinking clearly, can't remember your phone number, don't know what day it is, people around you are confused or whatever, that's another reason to seek care. So where can I get tested? You can get tested. Almost all of the doctors in town have tests, so you should call your regular doctor. If you don't have a regular doctor, as I've said for a year and a half now, that's one of the best investments you could do, is get a regular doctor. If you don't have a regular doctor, you can get tested at the urgent cares. So the 3 urgent cares in town all are doing lots of testing. So can I talk about the booster trials data? So the booster trials data that we've seen comes from people who had weakened immune systems. And what they found was that people, especially those people with solid organ transplants, with kidney transplants or heart transplants who are on immunosuppressive medication. So when you get a kidney transplant or heart transplant, you can't just put it in there and call it all good, because your body would see this organ from somebody else and say, wait a minute, that looks pretty foreign to me, and it would start to attack it. Now you try, when you do these transplants, to put in the most compatible organ possible, but unless you get an organ from an identical twin, it's a little different than yours, and your body says, oh, okay, this looks like a foreign person, let me attack it. So to do that, to prevent that, you take some immunosuppressive medicines that makes your body blind to this new organ. Fortunately, it also makes your body blind to vaccines, and so it doesn't seem to, vaccines work much less well in people who've had solid organ transplants. So what they found was, when they measured antibody levels in people after 2 doses, many of them didn't have good antibody levels, so they gave them a 3rd dose. They found that more people had good reactions, and that's why they recommended a 3rd dose for those immunosuppressed people. Now, the other question about boosters or 3rd doses for all of us at 8 months, that data has not yet been fully published, so I don't know. Now, some of the data from Israel suggests that people have a declining level of antibodies 6, 7, 8 months, and that when they give them a 3rd dose, they get a nice peak. And so we've seen that data. I've not seen the data that they would use to recommend a 3rd dose for everyone. So this story is about the urgent care coming out to your car. And again, we'll talk with the urgent cares, but again, public health has no regulatory or other control over the urgent cares, and we'll talk with them again. There's a question about whether we at DPHN would do the drive-through testing clinics again. Those drive-through testing clinics were done in the beginning because PPE was scarce, and we had those special spacesuits where you didn't need to use a new mask each time. We had the only access to lots of testing through Quest Lab. But there are problems with that. One is the test took days to come back, and at the time that was about the best you could do, and they didn't cost anybody anything. The problem, unfortunately, now is that I don't think it's a good deal to wait a few days with the rapid testing, and in the drive-through thing, we cannot do rapid testing. So, what we recognize this. So we recognized early on that the drive-through did make sense early on, but we did the drive-through until we distributed testing, and the testing now is distributed to every little clinic in town. So the bigger clinics buy their own, the smaller clinics, we get them stuff through the state. Many of the pharmacies have testing now. So that's really where people should get testing, at their doctor's office, the pharmacy, we don't think the drive-through is really makes sense at this point. As well, as you'll remember, back when we were doing the drive-through, we were doing 5 or 10 cases a day. Now with 200 cases a day, the only people who can deal those 200 cases are the people who would otherwise be doing the drive-through. So we need to be focusing on the stuff we can do for the 200 or so cases a day, and we're letting our community partners, the hospitals, the clinics, and the urgent cares do the testing. So has the governor put in a request on behalf of Douglas County? So the way these requests work is the requests come from the county to the feds, and the county has put in the request. So it says for vents, ECMO personnel, there's no mobile ECMO units, so that's not going to happen. Ventilators, the hospital has plenty of ventilators. And personnel to staff them, yes, we've had a request for personnel. The problem, of course, is they send the National Guard. Great guys, but none of whom are ICU trained. The only medical people they send have been 4 EMTs. 4 EMTs is going to help, but it's certainly not going to help with the high-level care that you need in the ICU. And the high end, for anybody who's not worked in the ICU, it's pretty dang amazing. These ICU nurses are absolutely incredible in what they know. Not only do they know all this pathophysiology, they know how to work all these machines and tubes and whatever else. And it really is stunning how much it is. If you imagine how hard it is to fly a 747, it's about that level of difficulty to work in the ICU. And just like you wouldn't say, hey, let's pull a National Guard guy in who normally works as a truck driver to drive my 747, you really don't want to be pulling somebody who's not knowing what they're doing into an ICU to run all this stuff, because the potential for making a mistake and causing a terrible tragedy is there. So again, we're overloaded especially in ICU things. These ICU nurses are working longer shifts, taking care of more patients. Some are foregoing days off, so they're really doing a good job. So what we need to do is we need to stop sending people to the hospital. The best way to stop sending people to the hospital is to stop with cases, and the best way to stop with cases is to not get new cases. Remember, the incubation period for this disease is about 5 days. So almost everybody who's going to be diagnosed tomorrow got the disease 4 days ago. And how did they get the disease 4 days ago? Well, overwhelmingly, they got it because they went out with friends who were sick. They went to work with people who went to work when they were sick, or they did something where they gathered with people who were sick. They may not have known it, but at the time. So if people had 2 weeks of concerted effort to stay home, wear masks, really, really hunker down, we could really get this under control. And that's the best thing that we need. We don't, bringing in a truckload of vents, bringing in a portable ECMO machine, those things are so much less effective than just bringing down the amount of the disease. And then, once we do that over the next 2 weeks, then people need to get vaccinated so that if there's another wave, this next wave will be much less. So that's what we really need. The hospital really is as they say, treading water, sometimes sinking under a little bit and then poking their way out with incredible resolve. So we should be incredibly happy that we have such a great hospital here. But we need to help them. We need to help them so that the census doesn't continue to rise. If the number of cases rise, the census is going to rise. And there are some predictions that in the next few weeks, throughout Oregon, there could be 1,000 more people needing hospital beds than we have hospital beds. That is really, really tragic. And again, we can all have our place here. Stay home, wear your masks, don't go to crowded places. And then when this is all over, please go ahead and get the vaccine. So under the new school guidance at lunchtime with no mask, if a student was exposed to a positive student, would they be required to quarantine if they were spaced 3 feet apart? So the new school guidance says that if kids are in school and they're adequately spaced and adequately masked, that they don't need to do it. There are 2 areas I'm not sure. One is about being outdoors on the playground, and the second is with lunch. And we need to figure that out. There was a long discussion today about that, and they haven't decided on it yet. So Lee says, is it true that some local physicians are prescribing ivermectin? They may be. And again, this is not something that public health is going to be in the middle of, right? What you do with your doctor in the exam room is totally up to you. This is not where public health gets involved. I don't think there's good evidence for it, but again, we don't really want to get involved in that. So Bruce says, can I talk about the AY3 variant? Is it here? So the AY3 variant is a subvariant of the Delta. So what happens is Delta comes in and then Delta mutates a little bit further. There was one case in Oregon that we really looked at, and it had like 65 different mutations. It's really amazing how much this mutates. And so the AY3 variant is a variant of the Delta. It doesn't appear to be very different. Now we're counting it separately, but it does not appear to be very different from the Delta. But they're counting it. So you look at the AY2 and the AY3, you should count that in with the Delta. So my question is about my hospital or UMQA. What are they doing in regards to the surge? Are there 2 ICU beds full? So last I spoke with them, which was last week, they were doing okay. They are not caring for any COVID patients. Very small hospital. They don't have high-level respiratory therapy, and so they've not been caring for them. And again, the problem is not having the beds. So people think, oh, you just need to have the beds and that would be it. No, you really need the people to run those beds. So it would be like, Jesus, all those 747s lined up on the tarmac, you should be able to just be flying them. You can't really do that unless you have the specialized crew. So Katie says, I was wondering if you feel that it's safe for fully vaccinated people to gather indoors with other fully vaccinated people. Previously, I said yes. So back in May and June, I thought yes. Right now, I would not. I mean, right now, I wouldn't. I mean, again, if we're going to bring this down by Labor Day, really knock it back by Labor Day, we have to all take precautions about what we do. So I pretty much been hunkered at home for the last week because I can't, there's only one public health officer, I can't get sick. And so I've really, really, really been keeping it down. So Ken says, is there any data on previously infected people becoming infected with the new versions? Are they being hospitalized or it's mild, or how do they compare with the vaccinated? So it's a little hard to know, right? Because until this month, we only had 2,000 people or 3,000 people in the county who had the disease, and many of them had the disease early on and whatever. We are seeing some infections where people who were previously infected now are coming down with the disease again, and it goes in all variations. Some are mild, some are serious, and some have died. And so how does it compare with vaccination? You get some immunity from previous infection. A little less good than the vaccination in a study from Denmark, in a study from Kentucky, a little bit less than vaccination, but still something. And now people have been infected in August, probably almost all have the Delta variant, and so that they will have better antibodies against the Delta variant than they did against the previous ones. And so, yeah, I mean, being infected is a way to get some immunity. On the other hand, there's a lot of costs with getting infected. Not only would you feel sick, but there is in Douglas County a 10% chance you'll get hospitalized and a 1.6% chance you'll die. So I don't think that's a very safe way to get it. So the answer is, is there any possibility that a vaccination will better fight later versions? Well, all these third doses are going to be the same vaccine you had before. I would be eligible for the third shot until December, and it does not seem reasonable to get the same one for whatever's happening then. Yes, it would be great if we could develop a new vaccine against the Delta variant. But let's think about that. These vaccines came up incredibly quickly. So the January was when they figured out what the genetic code was to make the thing. And then in December, about 11 months later, we had our first vaccine, which was truly remarkable. The speed of the variants taken over is so fast that if you went back 11 months from here and you said, okay, what was happening last September so that we can make a vaccine for August, you would have not known about the Alpha variant, you would have not known about the Delta variant. So the vaccine you would have made then would have totally missed them. And what we've seen is that 3 months ago, we barely knew what the Delta variant was, and now it's everywhere. And so similarly, if you made a vaccine now against the Delta, it is so likely by the time you produced it in 6 or 7 months, there's going to be something else there that this new booster is not going to work on. This is the problem. This is the whack-a-mole problem where you think you have it beat and then it comes up again and then you think you have it beat. And so it really is, it really, 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 really is worrisome. So, Bruce says, is it true that the person who died waiting for an ICU bed might have lived? That I don't know any of the specifics about what's going on. The care that you get in the ICU, again, is very, very, very high-tech and specialized, and ICUs are ICUs for that reason. This person, if there was an ICU bed available and they got transferred to the ICU, they may have lived or they may have died. I think by the time you get admitted to the ICU, it's pretty much 50-50. But we shouldn't, in this day and age, be not having ICU beds. So Alan says, what's the first sign of symptoms that we should look out for? So for the disease, early on in the disease, it's very subtle. I will tell you the number of people who have this disease and you say, oh, when did you first? Well, on Saturday I was having things, but I thought it was allergies or smoke. I was coughing. And then Sunday I felt sick, a little feverish, but I thought it was like a sinus thing. And then by Monday I was feeling terrible and I got tested. So the early symptoms of the disease can be any of the long list of following: nausea, vomiting, diarrhea, runny nose, sore throat, headache, fatigue, loss of sense of smell or taste, fever or cough. So it could be any of those things early on. Again, there's not a lot of disease circulating in August. So if you have one of those symptoms, stay home. If you're better the next day, you're better. If you're not better the next day, get tested. But stay home. Now, in terms of the signs of symptoms that, say you have the disease, and the signs and symptoms that, ooh, this is getting serious, would be troubles breathing, shortness of breath, signs of dehydration, or mental status changes. So Casey says, given that the viral load with Delta is being so high, should we be more concerned about surfaces? Again, the most recent stuff suggests it's pretty much all in the air, either droplets or aerosol. So I don't think we need to be more concerned about surfaces, but I think we need to be more concerned about the high viral loads. So what happens with these high viral loads is that it spreads more in the room. Remember, early on we talked about these super spreader events, this choir practice in Washington, where one person exposed so many people that we called a super spreader event. And I think what we learned about those super spreader events is that some people had a little bit of virus and then some people had a lot of virus. Well, with the Delta, almost everybody has a lot of virus when they get it. And so I think you really need to be concerned about being indoors. And the other thing we're seeing is we're seeing more spread outdoors. So remember, I've said, look, outdoors is so much safer than indoors, and it still is. But we used to think that there was not much spread outdoors, but there are three recent incidents in the Northwest that make us worry. 2 outdoor concerts and an outdoor festival where there was a lot of spread. Little hard to know about the spread because you go to an outdoor festival, but you wait in line for food or you wait in line for the bathroom or you're inside in the bathroom. But 3 areas actually where there was actually a fair amount of spread in what was mostly an outdoor event. And so I think that's why the governor today recommended that if you're outdoors and you can have social distancing, that you would use a mask. So for example, if I was at a festival, you might carry the mask with you, and when you were then waiting in line for food or in the bathroom or whatever, use a mask. I think when you're out in the wide open spaces, you do not need to use a mask. But I think the viral load is high. There was a study from China where they looked at the original virus and they did very careful viral cultures, and they found that with Delta you could get as much as 1,000 times as much virus as you had with the ancestral strains. And we think that is why it's so contagious, is because the viral load is so high. So what can we do to support you and your team? We're all vaccinated, want to support. So let me have you call the hotline tomorrow and see what you could do. We always need people to do stuff that you could help. Make phone calls, call people, see how they're doing. So you might give us a call tomorrow and we'll see. So will schools reopen? Well, the current plan, and I've spent a fair amount of this week talking about this with the school superintendent, we do expect schools to be available to reopen. Again, this is all local decision making. So we've pretty much left it to the local elected school boards who really control schools. So the county has nothing to do with schools, really. The city has really nothing to do with schools. We have elected school boards who are elected among our citizens, and my father was a school board guy for a long time. And the story is it's up to them what they want to do. Now, they do take advice from public health, and the advice from public health would be that you should be very careful about getting as many of your teachers and school staff vaccinated. Because when we looked last year, almost all of the school cases that were transmitted in school were brought in by unvaccinated staff. The second is we would strongly recommend spacing, good ventilation, and masks, because we know all of those things work. But in terms of the decisions of schools reopening, we think that's up to the local school boards. So Tabitha says, when do we expect vaccines for kids? I don't know. That's one of the things that's been on and off and on and off. Last I heard, later this calendar year. So Allison says, are drug companies tweaking their vaccine recipes to fight the new variants? As I said before, they're certainly looking at it, but the variants are changing so much faster than you could develop new vaccines that there are no vaccines that fight the newer variants. All of them are back with the ancestral strain. So Kathy says, why are we not shutting down like the first round? Well, the shutdowns really need to be done by the state government, and the state government heard loud and clear from the locals that they did not want any statewide closure things. So they heard loud and clear that that's the story, and but we could shut down too, right? I mean, there's no reason you have to go and sit in a restaurant today. There's no reason you have to go to a big indoor meeting today. I mean, people can just make that decision to do that. Just go to the grocery store when there's nobody else there, get takeout. And so that's what I would hope people would do, is that we don't need necessarily somebody to tell us what we need to do. We should decide that the safest thing for our community is to not sit in a restaurant, not sit in a big meeting, and do that. So Becky says, why can't we be given ivermectin, hydroxychloroquine? I think we addressed that before. What your doctor prescribes for you, ivermectin, hydroxychloroquine, or whatever, is really up to them. I don't think there's good evidence they work. But again, this is really up to your doctor to decide what they're going to do. And if they want to prescribe it, I'm not stopping them. So what are your thoughts on local doctors refusing to vaccinate, treat, or educate their patients regarding COVID? Like I said before, I have zero control over the local doctors. I do talk to them on a regular basis. And just like anybody you would talk to, they vary in their opinions. Some are very aggressive about treating and educating, and some people still think it doesn't really exist or it's not very serious. And again, I can't really help you on that. So Sonny says, how many people are surviving this? Well, most. Again, remember out of 100 people get the disease, about 1 or 2 out of 100 will die. About 5 or 10 out of the 100 will be hospitalized and be pretty sick, but will recover. About 30 out of 100 who get this will survive, but then have long-term symptoms of what we call long COVID, where they have long-term COVID, where they have long-term symptoms, shortness of breath, achiness, mental fog, or something else. And probably 60 or 70% of the people who get this will survive, and it will be like a bad flu. So 100 people get the disease, 70% survive like it's a bad flu, 30 out of the 100 have long COVID and have long-term problems. And one of the interesting long-term problems is some people start off with an absence of smell or taste, and then their smell or taste comes back as something terrible. Some people say sewage. I heard somebody say everything tastes like sewage. That would be pretty gross. Or everything tastes like nail polish, or everything tastes like copper, or everything tastes terrible. And so it could be. So 70% of people survive with no long-term problems. 30% have long COVID. 5 or 10% get 5 or 10 out of the 100 get hospitalized and are pretty sick. I mean, I've never been hospitalized overnight, so I certainly wouldn't want that. And then 1 or 2 out of 100 will die. So that's the number. So has the survival rate changed from a year ago? No, it has been pretty much all the time. It is about 1.6% of our cases have died. I keep still saying it's 99%. I don't know where in the world they get that from. I mean, in certain age groups, yes. If you look at kids have a very high survival rate, but overall, it is not. I would love to see where you would say, where somebody says 99.9% of the people who have COVID survive. I mean, that just hasn't been seen anywhere. If you look anywhere in the world, the death rates are typically in the 1 to 3% range. So which vaccine has the lowest recurrence rate? That's a good question. Early on, we thought that the J&J was underperforming, but it looks now like all 3 of the vaccines are doing pretty good. So why are cases accelerating faster than states without mandates? So we don't have any mandates now. Our cases in Oregon are accelerating differentially. So they're not very fast in Benton County, was a relatively low amount of disease, not very much in Multnomah County, but a lot in the counties on the Washington border and a lot in southwest Oregon. And I think that's because we have low vaccine rates. So the governor said masks now outside. Does that include schools? And if not, why not? I looked at it. I do not know if it includes schools. So is it true that if you had COVID before and then get Delta, you're more sick than before? We've certainly seen people have COVID before and then get Delta. They don't seem to be particularly sicker or less sick than others. That's just a bad disease. I mean, just a bad disease in all ways. So if a vaccinated person shows less symptoms and can still spread it, isn't the vaccine just masking symptoms? Okay, this is such a falsehood here. So the vaccinated people show less symptoms, meaning like instead of being desperately ill, they're only mildly ill. They're not just, it's not masking symptoms. It's protecting you from being hospitalized and dying, and it's protecting you from getting hospitalized or dying, and overall, the amount of virus in the long time you have it can be as high as somebody who's unvaccinated, but generally is not quite as high and generally goes away quicker, so the total amount you spread is less. So this whole idea, I don't want to get vaccinated because I don't want to be a silent spreader, is just totally false. So Curtis says, can you speak about long COVID in kids? Well, there have been fewer kids with COVID, but we have certainly noticed some kids who have some symptoms that go on for a long time. In pediatrics, one of the things that we see is mononucleosis. So mononucleosis or mono or Epstein-Barr virus infection, where kids get this and they're just like so tired for a while. They just sleep and sleep and sleep. And we've seen some of that with kids with COVID. They have a mono-like illness where they just sleep for a long time. But we don't know as much about long COVID in kids because you remember that kids previously made up a smaller percentage. They're now making up about 20% of the cases. So Kayla says, what about melatonin? I've read as a preventive and helps mitigate cytokine storm. So melatonin is a normal hormone that your body makes to help regulate sleep. A lot of people take it for sleep. It is one of a bunch of drugs that are called repurposed drugs. So drugs that are approved for something else that could be used to treat COVID. And this is where ivermectin, hydroxychloroquine, fluvoxamine, melatonin, doxycycline all come in. Again, the data on all this stuff is not great. So what is the current timeline on this current spike? I spend a tremendous amount of time looking at data from all different places in the world, getting us a sense of what we can expect. And again, this is like predicting the weather, and the further you get out, the more chance your predictions are, right? So the weather is usually good about what's going to happen this afternoon, a little bit less better what's going to happen over the weekend, really not very good about what's going to happen on Labor Day weekend, although they try. When we looked at other places that are similar to Douglas County that have had spikes, their spikes have typically lasted anywhere between 41 and 73 days. So in Louisiana, it looks like their spike started on July the 4th and peaked on August the 14th. But in Arkansas, it looks like their spike started on May 31st and ended in August the 12th. In the UK, it started on May the 16th and peaked on July the 21st. So about 67 days. So I don't know, but typically these COVID spikes don't go on, these COVID Delta spikes don't go on forever, and they stop for one of a couple of reasons. One is basically it spreads to the population, enough of the people had it that it dies out. This is unlikely to happen in Douglas County because although we have a lot of disease, we don't have that much disease. The other thing that happens is it's a combination of more people getting it and more people doing this, staying at home, wearing masks, and that brings it down. We started our this peak somewhere between, well, it's a little harder to tell when we started this peak because if you look at these other places, they really look like camels, big peaks, and you could get where the low point was. We had so little disease in the beginning of July that it's really hard to tell when this peak started, but somewhere probably between the 4th of July and the 18th of July would suggest that the peak of our cases should happen anywhere between now and a month from now. Now, I know that's not great predictions, but this is really, really hard to predict. So I would predict that the timeline on this is that we would peak sometime between now and a month from now, and then it would slowly go down. And unfortunately, what we've seen in the UK and these other places, it doesn't fall to the ground. It goes down fairly slow. So if you test if positive at a home test, can they get remdesivir? So remdesivir is only for people who are hospitalized, and so you need to be hospitalized to get it. So if you did a home test and was positive, they would test you again at the hospital. And if you were positive and met the criteria, you could get remdesivir. So do you need a prescription for antibody test? Where can I get it? You don't need a prescription, but you do need a doctor's order for an antibody test. And any doctor can order it. So if they get it through Quest or Mercy Lab or any of those places, can order an antibody test. So what is your opinion on the monoclonal antibody infusion? So there are a number of monoclonal antibodies that you can get either by IV drip, takes 45 minutes or an hour or so, or you can get with 4 hourly subcutaneous injections. They seem to work. I mean, they seem to decrease the risk of hospitalization or death by more than 50%. So that's pretty good. The trouble with it is it takes it takes an hour to do the infusion, then 3 hours to watch. So it takes a lot of person power to do that. And at least in the studies, it didn't really prevent any deaths. So it's probably most effective at post-exposure prophylaxis. So for example, let's say I had a kidney transplant. I know I didn't have good antibodies and I got exposed. It probably works best at post-exposure prophylaxis. It works a little bit if you treat people at the beginning of the disease. If you wait until people are really sick in their hospital, it works less well. So again, it works at best as post-exposure prophylaxis. And it does work some, but it's a lot of work for not much gain. Far and away, absolutely far and away, the best thing would be to get more people vaccinated. So why are fully vaccinated people dying from COVID? Well, fully vaccinated people are dying from COVID, not very many of them, but when they are, they tend to be really old people who did not make a good antibody response. So how did emergency approval impact data for long-term safety of the vaccines? Not at all. So one of the things we're going to talk about today is that Pfizer got full approval. If you look at I did a video last week trying to convince somebody to get vaccinated, and we talked about emergency use approval and then full approval. So full approval means that you have done your phase 3 studies, as was done with this, that you have 6 months of follow-up data, and then all of that data is carefully reviewed. So remember, these studies started in November and December. 6 months then got you into April, May. Then the FDA, which usually has an 8-month process where people work with due speed, but they're not working nights and weekends. With this, they absolutely put all the efforts into doing this review quicker. They didn't leave out any parts. They looked at everything. They went over individual records for people in the trials. They visited the factories to be sure that they were doing all the things that they were supposed to do, and that's why they came up with the full approval. So I don't think emergency approval impacted data at all. In fact, if anything, the data for these vaccines are far better than the data for other vaccines we've approved. I mean, if you look at the data for which we've approved Shingrix, which is for zoster, or for any of the other vaccines, the data on this is very complete. So how long do your antibodies last after getting COVID naturally, Aaron says. So it looks like you peak with your antibodies in a few weeks after the illness, and then they fall. They seem to fall a little bit quicker than with the vaccine, so 1 or 2% per month. So Sharon says, is COVID-19 a disease? So there's been craziness here. So the virus that causes this SARS-CoV-2, and the disease is called COVID-19. This is how we do everything. So when you get chickenpox, the disease is chickenpox. The virus is varicella zoster. When you have meningococcal meningitis, the germ that causes it is Neisseria meningitidis. So almost all diseases have both a disease name and a germ name, and sometimes they kind of share it, but generally not. So whooping cough, a disease caused by a thing called Bordetella pertussis. So COVID-19, a disease caused by SARS-CoV-2. So if you're ever confused about that. So how reliable are the at-home tests? They're pretty good if you do it exactly according to the directions. So if you do these exactly according to the directions, they're good. I have to tell you sort of a background story here. I cannot tell you the number of people who did home pregnancy tests, which are actually easier to do than these, and screwed it up. They peed on the wrong thing, they dumped it in the toilet, they did all kinds of things, and their pregnancy test came out screwy. And I said, well, did you read the directions? Well, not really. I thought it would. And so I'm sure with this, there are some people who are not doing it exactly correctly, but if done correctly, they're very good. They're the same testing material and the same methodology as the Binax. So am I worried with winter and being inside and this is going to get worse? Well, no. Winter is going to be a problem, right? Winter is going to be an issue, but I don't think it could get much worse than it is now. And what we've looked with this virus is that many of the big spikes have happened in warm weather. So, I mean, I always worry about the winter for all kinds of diseases. But there's not here. So is the variant issue from opening our borders? So certainly not opening our borders with Canada, which we haven't really, and certainly not from the southern border. Actually, Mexico is not having a lot of disease. Most of the disease that we've seen in Douglas County came from other places in the United States. So it came from Missouri, Arkansas, Oklahoma, California, Arizona, and Alaska. That's where it did. It came from those areas. Now, how it got to those areas, I don't know. I mean, I can't follow back that far. But I don't think this had anything to do with had much to do with the southern border, and I don't think this had much to do with the northern border. I think this has to do with the fact that people travel, and people go to Disneyland, and people go to Disneyland from places where other people around have it. One of these things was a pageant where people from around the country came, and that is how this spreads. If we have a positive result from a home test, should we stay home and not go to the ER? Yes. So if you have a positive result from a home test, you almost certainly have it and you should stay home, especially if you had the positive home test because you had symptoms. So the chance that you have the symptoms of COVID and have a false positive test is vanishingly small. You have COVID. Stay home. Stay home for 10 days after the onset of symptoms or the test, whichever is more obvious. and don't go out and don't spread it to other people. Don't go to the ED unless you're having one of those symptoms of shortness of breath, dehydration, or delirium. So do masks actually stop viruses? Yes. So how do masks stop viruses? So I have my trusty little surgical mask here, and they stop in two ways. They're actually probably more effective in preventing you from spreading it to other people. Because when I cough or sing or whatever else, there are some big droplets come out that have lots of virus on it. There are some smallish droplets that come out that have a little bit of virus on it. And then there are some aerosols, incredibly tiny droplets that are out there. The mask does an incredibly good job at stopping big particles. It does a very good job at stopping small particles, and does some good at stopping those aerosols. Similarly, if I'm wearing a mask and you cough and sneeze, it stops the big loogies, and it stops some of the smaller ones. It's not as good as the aerosols, but it still works. I mean, it still is quite effective. If you want to get really effective, you need to use a very high-level mask, an N95 mask, and N95 masks really work. I mean, I use N95 masks when I'm at the clinic and otherwise, because the N95 masks are the most effective. So masks really do work. So Deanna says, is there any chance that this peak is related to the fair? There are a bunch of cases that are related to the fair, and that is a big concern. They were they're almost all indoor activities, and so indoor activities really we did see was a risk factor for the fair. However, I do not think that the bulk of this is from the fair. When we're seeing this, the overwhelming story is an unvaccinated person gets the disease, brings it to work, and spreads it to others. We have 13 current long-term care facility outbreaks. 13. You know, in the past we'd have one or two and we'd be like, oh, it's terrible. We have 13. And in almost every case, an unvaccinated person got this disease in their life. They then brought it to work and infected other workers there and some of the people who are in long-term care. And many of the hospitalizations and many of the deaths among the breakthrough are from people in long-term care facilities where an unvaccinated person got sick and brought it in. This is why there's now the requirement that people who work in those areas get vaccinated. And again, when we look at schools, when we look at long-term care facilities, when we look at workplaces, it's almost always an unvaccinated person who gets the disease and then brings it in. Now, is it sometimes a vaccinated person who gets it and brings it in? Yes, we have one of those cases. So I'm not saying it's always an unvaccinated person, but overwhelmingly it's unvaccinated people who bring this to other places. So does the vaccine affect fertility? Nye says no, it doesn't. So good studies that looked at people who were in the trials and good studies where they look at sperm counts, it doesn't affect fertility, which is great. Now, one of the things that people have said it affects is periods. A little hard to know about periods, right? So periods are quite variable and they change with stress. Periods change with activity, periods change with change in weight, and obviously with pregnancy. So they change with lots of different things. And people have said, oh, my periods have changed after they got vaccine. When they looked at it, there doesn't seem to be anything statistical about that versus people who are vaccinated versus not vaccinated. But there's absolutely no data that this affects fertility. And again, this is one of the things that keeps getting circulated and really is a big fear, right? If you're a young person, you say, well, my risk of this disease is pretty low, but I'm really looking to have a family and I really don't want to have this vaccine if it's going to affect fertility. And so I can see why that would worry you, but there's nothing to suggest that this will affect fertility. I will tell you that whenever people want to do a scare campaign, affecting fertility is one of the first things that come out because it's so hard to know about your fertility in the future, and it's one of those things that really gets people worried. But there's no data that the vaccines affect fertility. Now, if you get the disease and you die from the disease, that affects your fertility. Okay, let's go through a few more things and then we'll see. So we talked about the Pfizer approval. So again, the Pfizer approval is full approval for the Pfizer vaccine for those 16 and above. That means that It has gone through the full safety and factory review, and that's a great thing. And then on the third dose, it's already been approved for those people who are immunocompromised, and there's a lot of talk about being approved for people, for the rest of us, 8 months after our second dose. Okay, it looks like the questions have dried up. That is good because I'm getting tired. We'll do this again next Tuesday. But again, a couple things I would ask. One is, if you're sick, please stay home. The second is, if you're outdoors and around people, please wear a mask. Avoid indoor crowds. Get vaccinated. This week we looked at our vaccine numbers in the past. Maybe 200-300 new people getting vaccinated. Last week it was 1,200, which is our highest number in a very long time, and that's a good thing. So get vaccinated and really think about how this is affecting our community, especially our hospital, and how we want to protect our hospital in this time. If you have the disease, we have a video about what you do if you have the disease. We have another video, if you have the disease, when do I get worried? That's the second video. And the third video is, I was in contact with somebody who had the disease, and what do I do? Those will be up by tomorrow, and you can look at those. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you, and be safe and be kind and be careful. This is a really tough time. Thank you.